Dabigatran is direct oral thrombin inhibitor. It is an anticoagulant medication which helps to prevent thrombi or blood clots from forming. It can be a useful replacement for heparin in people with a history of heparin induced thrombocytopenia. Now let us talk about the mechanism of action. Dabigatran is an oral direct thrombin inhibitor. Activated thrombin leads to cleavage of fibrinogen into fibrin monomers that upon polymerization form a fibrin clot. Both clot-bound thrombin and free thrombin are inhibited by dabigatran. Let us now discuss the pharmacokinetics of dabigatran. Dabigatran etexilate is administered orally. It is hydrolyzed to the active drug dabigatran by various plasma esterases. Dabigatran is metabolized by esterases. It is a substrate for P-glycoprotein and is eliminated renally. Dabigatran is mainly eliminated by renal excretion and hence it is contraindicated in patients with creatinine clearance of less than 30 ml per minute. Moving towards the therapeutic uses of dabigatran, dabigatran is approved for the prevention of stroke and systemic embolism in patients with nonvalvular atrial fibrillation. It may also be used in the treatment of DVT, which is deep vein thrombosis, and PE, which is pulmonary embolism, in patients who have already received parenteral anticoagulants and as prophylaxis to prevent or reduce the risk of recurrence of deep vein thrombosis and pulmonary embolism. Next, I am going to talk about the adverse effects of dabigatran. The major adverse effect, like other anticoagulants, is bleeding. Gastrointestinal adverse effects are common with dabigatran and may include dyspepsia, abdominal pain, esophagitis, and GI bleeding. Abrupt discontinuation should be avoided as patients may be at increased risk for thrombotic events. Now I am going to discuss the contraindications of dabigatran. The drug is contraindicated in patients with mechanical prosthetic heart valves and is not recommended in patients with bioprosthetic heart valves. Dabigatran should be used with caution in renal impairment or in patients over the age of 75 as the risk of bleeding is higher in these groups. Idarucizumab may be used as an antidote to reverse bleeding in severe cases. I would now like to discuss a few points of patient counseling that one should know while taking dabigatran or one should tell the patient while prescribing them dabigatran. Number one is swallow capsules whole. Do not break, chew, crush, or open. Do not administer by NG tube. Number two, avoid using with other anticoagulants unless benefit outweighs risk. Monitor for additive effects with other drugs that can increase bleeding risk, such as antiplatelet drugs, some herbals, NSAIDs, selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, and thrombolytics. Number 3. Dabigatran is a substrate of P-glycoproteins. Avoid use with P-glycoprotein inhibitors such as rifampin. Number 4. Do not stop taking dabigatran without talking to your prescriber. Stopping dabigatran increases your risk of developing a clot. So dear viewers, I hope you find this video informative. Keep watching Pharmacy D by Asim and the links are given below in the description. Follow us on different social media platforms. Thank you.